Research shows that 18 million men in the United States experience erectile dysfunction. But here's what most guys don't know. Studies show that men who exercise more have better erectile and sexual function. The problem? Most men are making simple mistakes every day that hurt their penis health without even knowing it. Let me be real with you. Over 2 in 5 men aged 18 and older report erectile dysfunction. That's almost half of all men. And it's not just older guys. Around 11% of young men aged 18 to 31 years old reported mild erectile dysfunction, and almost 3% experienced moderate to severe erectile dysfunction. The truth is, most men are doing things wrong. They're taking their medication at the wrong time. They're not tracking what actually works. They're skipping the exercises that could help them. They're ignoring the warning signs their body is sending. Erectile dysfunction is an early sign of cardiovascular disease. Your penis is trying to tell you something important about your health. But if you're making these common mistakes, you're missing the message. I'm Dr. Marcus Reed, an AI health educator presenting research-backed information on men's sexual and urologic health. Let me share what the science actually says. Research shows erectile dysfunction can occur as early as 2 to 4 years before a major heart attack or other cardiovascular event. Your penis is like an early warning system for your whole body. Here's what major medical centers have found. Studies, published on PubMed, suggest that morning erections are a sign of healthy blood flow in the penile artery. The penile blood vessels are extremely fine and can be early indicators of atherosclerosis or circulation problems. When morning erections decrease or disappear, research shows erectile dysfunction can precede cardiovascular events by 3 to 5 years. The American Urological Association and the Journal of Sexual Medicine have published clear guidelines. Pelvic floor muscle exercises are effective in treating men with erectile dysfunction and should be the first-line approach to treat the problem. Studies found they helped 40% of men with ED regain normal erectile function, and an additional 33.5% significantly improved their erectile function. Blood flow is everything. Research published in 2023 in the Journal of Sexual Medicine shows men who exercise more have better erectile and sexual function. Researchers analyzed 11 different randomized controlled studies involving more than 1,000 men looking at aerobic exercise like running, walking, and cycling. But here's the problem. Knowing what to do isn't enough. You need to track it. You need to see what works for your body. This is where research on tracking and data-driven health changes everything. Studies show that when men track their sexual health patterns, they identify what works much faster than guessing. Clinical research demonstrates that data tracking leads to faster identification of effective approaches. That's exactly why Peak Performance Tracker exists. It's built on principles from urological research. It helps you track the things that actually matter based on science. Track your morning erections. Research shows they're health indicators. Track your exercise routine. Studies prove it helps erectile function. Track your medication timing. Clinical trials show timing matters more than most men think. The app uses the same approach that urologists recommend. Track the data, find the patterns, see what works for you, and you can start tracking completely free to see how your body responds. Research shows men who track their health data make better decisions. They spot problems earlier, they find solutions faster. Let me walk you through what the research says actually works and how tracking helps you do it right. Mistake 1. Ignoring morning erections. Healthy adult men typically experience morning erections 3 to 5 times per week. These aren't random. Morning erections deliver oxygen to penile tissue, maintain erectile function, and mirror testosterone levels and sleep quality. When they decrease, it may signal the onset of cardiovascular disease. But most men never track them. With Peak Performance Tracker, you log your morning erections daily. The app shows you patterns over weeks and months. You see if things are getting better or worse. This gives you real data to share with your doctor. Mistake 2. Never doing pelvic floor exercises. After 3 months, the erectile function of men in the intervention group doing pelvic floor exercises was significantly better than the control group. It may take up to 6 months to see improvement in erectile function, but most people notice a difference after 6 to 8 weeks. The problem? Most men don't know how to do them right, and they give up too early because they're not tracking progress. The app includes guided Kegel exercise programs. It reminds you to do them. It tracks your consistency. Research shows consistency is everything. Studies demonstrate pelvic floor muscle training is an effective therapy when done correctly and regularly. Mistake 3. Taking medication wrong. This is huge. 69% of guys who reported their penis problems persisted even after taking PDE5 inhibitors like Viagra, Cialis, and Levitra were making some errors when taking the pills. Over 20% of men in the study made the mistake of taking Viagra or Levitra too soon after eating. Food slowed the rate of absorption, delaying mean time to maximum concentration by approximately 1 hour and reducing maximum plasma concentration by 29%. But here's the thing. There were no significant differences between pairs of treatments on satisfaction when timing was tested properly. You just need to find what works for you. Track when you take your medication. Track when you eat. Track what happens. The app helps you see patterns. Maybe you need to take it earlier. Maybe with food doesn't matter for you. The data will tell you. Mistake 4. Not moving your body. Men with cardiovascular issues may notice a decrease in morning erections, which can be an early indicator of underlying health problems. Exercise fixes this. Regular exercise, particularly aerobic activities, can improve heart health and boost blood circulation throughout the body. Better blood flow means better erections. But you need to track it. Log your workouts. See how your performance changes. The app connects your exercise data to your sexual health data. You'll see the connection research has proven. Mistake 5. Eating junk food. A 2020 study from Harvard looked at testicular function in a sample of nearly 3,000 men in Denmark. Junk food hurts sexual function. Research shows what you eat affects blood flow. It affects hormones. It affects everything. Track your diet in the app. See how certain foods affect your performance. You might notice patterns you never saw before. Mistake 6. Smoking and drinking too much. A British Journal of Urology international study published in 2022 looked at over 6,000 men. Current smokers had lower libido and higher rates of erectile dysfunction. Too much alcohol consumption can lead to serious problems, including trouble with getting it up or issues with stamina. Track your alcohol intake. Track smoking if you're trying to quit. See how it affects your data. The numbers don't lie. Mistake 7. Not getting enough sleep. A literature review published in 2020 in the journal Translational Andrology and Urology analyzed research looking at the relationship between sleep quality and sexual health. Several different factors were considered, including erectile function, libido, testosterone levels, and fertility. Poor sleep hurts everything. Morning erections happen during REM sleep. Less sleep means fewer morning erections means worse erectile health. Log your sleep hours. The app shows you if there's a connection to your performance. Mistake 8. Sitting too much. Healthy men who watch more than 20 hours of TV per week have a 44% lower sperm count than those who watch almost no TV. Sitting kills blood flow. Physical inactivity includes spending a significant part of your day sitting or lying down. Lack of physical activity was a strong independent risk factor for erectile dysfunction. Track your daily activity. Even just standing more helps. Mistake 9. Trying just one medication. That was the most common mistake made by men in the study. 40% didn't try another kind after the first was unsuccessful. Every patient will respond differently between drugs. Viagra might not work, but Cialis might not, or vice versa. Track which medications you've tried. Track the dose. Track the timing. Track the results. This data helps your doctor find what works for you. Mistake 10. Not tracking anything. This is the biggest mistake of all. Many men delay seeking help due to fear or embarrassment. Ignoring symptoms can lead to larger health issues. Without tracking, you're guessing. You don't know if things are getting better or worse. You can't show your doctor real data. You can't identify patterns. Research shows tracking changes everything. When you see your own data, you make better choices. You catch problems early. You find solutions faster. Research on digital health tracking shows it works. Digital health can support the provision of information and access to care across the sexual health continuum and facilitate the delivery of differentiated care with tailored and layered interventions. Studies on medication tracking show men who optimize timing see better results. Clinical trials on exercise programs show consistent trackers have better outcomes. Research on pelvic floor training shows tracking compliance leads to success. The pattern is clear. Men who track their health data get better results. Peak Performance Tracker uses this research. It's designed around what urologists know works. Over 10,000 men are already using it to improve their sexual health. Research shows men who start tracking identify patterns within their first 2 weeks of consistent data collection. You see what works? You stop guessing. Think about the old way versus the new way. Old way? Generic advice. Just exercise more, try different pills, and hope something works. No data, no tracking, just guessing. Studies show the prevalence of cardiovascular risk factors was higher among men with erectile dysfunction at all ages, and lack of physical activity was a strong independent risk factor. Generic advice doesn't work because every man is different. New way. Track your data, see your patterns, find what works for your body, science-backed exercises, medication timing based on your schedule, evidence-based approach proven by research. Here's what you need to do right now. Download Peak Performance Tracker free today and start tracking your progress. Research shows most men identify patterns within their first 2 weeks of tracking. 2 weeks, that's all it takes to start seeing what works for you. The basic tracking features are completely free. You can track morning erections, exercise, medication timing, and performance metrics without paying anything. See the patterns? Watch your progress? Want the full program? Upgrade to Premium for $14.99 per month. That's less than one doctor visit copay. You get AI Assistant for questions, advanced analytics, custom exercise programs, and educational videos from urological research. Join 10,000 plus men using data-driven approaches to improve their sexual health and performance. Start with free tracking and see the difference data makes. The link to download Peak Performance Tracker is in the description and pinned in the comments below. Taking control of your sexual health starts with understanding your body. Ideally, you should see a doctor once a year for a penile checkup. But between those visits, tracking gives you power. Download the app and start tracking today. Your penis is telling you something. It's time to listen.